Hi, my name is Trent Hulse. I'm an orthopedic surgeon here in Enid, Oklahoma. I work at St. Mary's Regional Medical Center. I was born and raised here in Enid, and I grew up here, and then I went on to get my medical degree from the University of Oklahoma, and then I did my orthopedic surgery residency there as well at the University of Oklahoma Health Science Center. I'm here today to talk to you a little bit about knee pain, arthritis, and also some of the new exciting things that we're doing here at St. Mary's with regards to robotic technology and knee replacements. Certainly pain in the knee is not normal necessarily. Pain going up and down stairs can be a very common sign that something more serious may be going on in your knees, such as arthritis. Specifically, if you have knee pain kind of behind your kneecap, that can be some pain that causes you to have issues going up and down stairs. So certainly I think that is something that is worth talking to your doctor about. Some other things that I think would be helpful to talk to your doctor about would be pain first thing in the morning. We call that, or first when you get up would be startup pain. That's something that can be worrisome as well. Or pain just doing your daily activities, housework, gardening, things like that. If you're having pain with just those day-to-day activities, I think that's something definitely worth talking to your doctor about. Arthritis is a term that is used to describe briefly the kind of the breakdown of cartilage in your knee. But what that means is all of our joints in our body, specifically our knee, have very soft coverings to the ends of the bone that allow the bones to glide smoothly. Arthritis is a term referred to as when that soft cartilage begins to wear away. So the bones no longer really glide smoothly against one another, and so they rub and cause pain and inflammation. So that is what arthritis is. Unfortunately, there's not a cure for the arthritis, but certainly we have many treatment options, both operative and non-operative, available that can help alleviate the pain. Certainly it is more common with as you age, but certainly there are people out there that are older without arthritis. So it's not always, just because you're older you're getting arthritis. It is something that is very common and can sometimes happen at an earlier age. It's something that is one of the most common reasons for disability in America. I think over 50 million people have been diagnosed with arthritis, which then comes to no surprise that there are over 700,000 knee replacements done a year. Well, certainly there are a lot of reasons to cause joint pain, and it's not always arthritis. There are other reasons to cause joint pain. So for me to know if you have arthritis, first off is a physical exam. And then that combined with x-rays and sometimes even an MRI is required to diagnose the arthritis. Those things combined together will help me define whether or not you have arthritis. That's a very common question I get is when do I know it's time to have surgery? Well, I'm personally very conservative in my approach. I like to exhaust all of the non-operative treatment options, and there are a lot of them, such as injections and supplements and exercise, yoga. There's a lot of things we can do prior to surgery to alleviate your pain. But if we've done all of those things and you're still limited in a lot of your day-to-day activities, having pain, and just really having more bad days than good days as far as your joints are concerned, that may be a sign that surgery is right for you. There are definitely multiple options for surgery. We have arthroscopic surgery, which is a minimally invasive surgery that is usually reserved for mild cases of arthritis or things like meniscus tears, which are just little tears in the cartilage that we talked about earlier. And if you don't have bad arthritis, you can maybe be a candidate for an arthroscopic procedure, and that's certainly less invasive. But if those things have not worked, or if you're to the point where your arthritis is more severe, then that is something that you may be a candidate for either a partial or even a total knee replacement. The replacement is more of like a resurfacing. So basically we put a new covering on the ends of your bones. It's a metal covering, and then there's a little plastic cushion between there that allows those metal coverings to bend and glide smoothly. So it's essentially resurfacing with some metal components as well as a little plastic cushion in there. It does not mean that a robot is doing your surgery. That is a common misconception with robotic technology in total knee replacements. I am still at the bedside. I'm the one doing the surgery. The robot is something that we have used and are beginning to use more with allowing more precise cuts and allow us to give a more unique, personalized replacement. So it gives us real-time feedback in the operating room about your specific anatomy, but I am still at all times in control of the surgery, and the arm is never making any cuts. It's always me making those cuts, so I'm still very much in control and your surgeon. Part of the ROSA process is obtaining x-rays prior to surgery, and that can be used to turn into a computerized 3D model of your knee. And that allows us to send that information and use that in surgery to make adjustments as necessary that allow us to give us a little more precise replacement based upon your specific anatomy. So we use that information preoperatively, and we use that intraoperatively to carry out a preoperative plan. There are some trackers that we place on your leg that then communicates with a camera in surgery. And then we take multiple points on the knee that tells the computer where exactly every specific part of your knee is in space. And then that gives me real-time feedback intraoperatively of your specific anatomy and how things are tight or loose in the knee, and how I can make adjustments specifically based upon your knee. Every single patient has their own different anatomy. There are a lot of different wear patterns in arthritis as far as you can wear out one side versus the other, and everyone's a little bit different. Everyone's soft tissue is different, so every surgery, despite everyone getting a knee replacement, each one is individualized to that patient and their specific situation and severity of their arthritis. You know, knee replacements have been revolutionary in medicine for the last several decades, and people have done very well with that. But there are definitely a subset of population that maybe isn't as happy with their knee replacement as we would like. Maybe 1 in 5 patients reportedly is not super happy with their knee replacement. So this is an approach that I think can really start to hone in on those 1 out of 5 patients and give them a little bit more precision that will hopefully lead to an improved outcome. There certainly is a very extensive preoperative preparation process that St. Mary's will guide you through. That includes diet and exercise and even up to what equipment you need to bring and what shoes to bring and all the kind of clothes you need to bring. So there are a lot of things to prepare for a surgery like that, and St. Mary's will guide you through that process. So here at St. Mary's at the Joint Replacement Institute, we have an excellent length of stay record. So probably 90% of our patients go home the next day. So you can expect a single night hospital stay. You can expect while you're here, you'll receive extensive physical therapy, personalized dietitian and physical therapist and nursing care that are dedicated to just our joint replacement patients. And that certainly, I think, has led to improved outcomes here. Certainly, you have a lot of options around here as well as in Oklahoma City about where to have your knee replacement done. I think that the Joint Replacement Institute here at St. Mary's is top-notch. I've trained in Oklahoma City, and the Joint Replacement Institute here absolutely compares, if not exceeds, everything that there is in Oklahoma City. It is something that you want your experience to be very personalized. You want it to be very dedicated to you, and that is what we have here at St. Mary's. We have a wing of the hospital that is specifically designed for joint replacement patients only. There's no one with infections, there's no other patients in this wing of the hospital. The therapists are dedicated to the joint replacement patients. And you want a place that does a lot of them. And St. Mary's does several hundred a year. which does characterize it as a high volume replacement center. And that is something that studies have shown where there's a consistent improved and better outcomes in places where there's a higher volume of cases. So that is certainly something that the St. Mary's Joint Institute provides. Thank you for your time. I hope I was able to answer most of your questions. Certainly, if you have any further questions or any concerns, please feel free to contact us here at the Orthopedic Department. We look forward to the opportunity to serve you here at St. Mary's Regional Medical Center.